Well, I want to welcome everyone today to Cross Talk. It's a production of MUSC Hollings Cancer Center. This month, we're focusing on breast cancer. We're going to try to highlight important advancements in treatment and prevention. We have two special guests today. First, I want to welcome Dr. Andrea Abbott, breast cancer specialist and surgeon here at the Hollings and MUSC. And later in the show, we're excited to have a breast cancer survivor, LaToya Wilson, join us. First of all, Dr. Abbott, thank you for joining us today.
Yeah, you're welcome. Happy to be here.
Great. Well, breast cancer is one of the most commonly diagnosed cancers in women, and that's your specialty. It's the second most common cause of cancer death among women, next to lung cancer. It's one reason we want to focus on advances in treatment and screening. So what are your thoughts about screening and prevention, and why is that so important?
Yeah, I think you've hit the nail on the head. Screening is great. It leads almost in a sense to early detection, and for some people prevention if they know that they're at high risk. The current recommendations are to start screening for most women at the age of 40 with a mammogram. At Hollings, we have the ability to offer screening mammograms in a lot of our locations in West Ashley, North Charleston, Mount Pleasant, and downtown. So trying to get the screening out to where the patients are. And soon we'll also be mobilizing our van that will bring mammography out into the community. So we're excited for hopefully the launch of that in October. Mm-hmm. So starting at age 40, for most women, if there's a strong family history, then that mammogram screening may need to start sooner. Mm-hmm. When you ask why that's important, the smaller the cancer, the earlier the detection. That means maybe you can avoid some of the treatments like chemotherapy, maybe surgery and radiation are the only things that you need. So you have more options if you catch it early.
Great, yeah, I'm a big proponent of that. What about advancements in treatment and what's going on in that front?
Yeah, so I think one of the things that we're constantly trying to do here at Hollings is study breast cancer, better understand it, and really tailor treatments for patients. So instead of throwing the kitchen sink at something which may not be appropriate mm-hmm. for every patient, we're trying to really hone down and figure out, are there particular markers, or does your cancer have a signature that will allow us to tailor that treatment to you? Maybe you wouldn't respond well to a certain type of chemotherapy, so we can change that and give you only the drugs that you need for your case. To that end, we offer a lot of clinical trials here. We are trying to see what types of surgeries would be appropriate for patients. So maybe a patient would be a candidate for a nipple-sparing mastectomy, which would allow them to preserve the nipple and kind of the cosmetic mm-hmm. look mm-hmm. Of their breast, and we work very closely with our plastic surgeons to do that. One of the new exciting things that we're offering is nerve preservation. So we're trying to do nerve grafting to the nipple to preserve sensation. That's something new that we're really starting here, and we're excited to hopefully offer that to patients in the future.
Yeah, that's wonderful. What are your thoughts about improving, and you've touched on this, quality of life and the whole sort of breast reconstruction issues that come up?
Yeah, I think this is a really difficult topic. You're coming in with a diagnosis of cancer, and I think sometimes the first thing that you think about is, I just want to live. Like that's, mm-hmm. take care of my cancer, I want to live. But I want you to start to also be able to think 2 years and 5 years and 10 years down the road. We're going to do the best that we can to treat the cancer, but I also want you to be happy with your body image. I want you to feel free to go to the beach and wear tank tops and feel confident with yourself as a woman. And to that end, it's really trying to figure out what your priorities are. For some patients, they want the simplest surgery so they can get back to work, and maybe that's a lumpectomy for them. Maybe mm-hmm. that's a same-day surgery. For other patients, it may be the strong family history and the fear that, I don't ever, want to be back here again, and I want to do a really comprehensive approach to my surgery. I want to have bilateral mastectomy so that I have symmetry, and that's important to me, and I understand that's a longer recovery, and maybe mm-hmm. that's 6 or 8 weeks, and maybe that's multiple surgeries, but that's my priority. So it's really having that conversation, being in a place where you have multiple specialists who can give you all mm-hmm. that advice, mm-hmm. and then listen to you and put that all together to put the plan together that's perfect for you.
Yeah, that makes a lot of sense. One thing that that's happening now is women are surviving longer with breast cancer. When I first started in my research career, it was not as long as it is now. It was much shorter, and this has been a huge success for the whole field, and a lot of kudos to people that support the research and all these efforts. But with that longer survival, you know, women, I think, do need more support. And you've recently started this online support group, and I know you're working on a podcast and other things. Can you tell us more about that and some of the topics you're going to try to hit on those broadcasts?
Absolutely. So there are over 3 million breast cancer survivors in the United States.
Yay.
And so absolutely, we've poured so much effort into prevention and screening and detecting those cancers early. And now we also have to think about how do we support women, you know, after the treatment is over. You know, I think it's a very scary time to transition from you're seeing doctors all of the time, you're well supported, and now we say, okay, it's been, you know, 5 years, good luck, you know, follow up with your primary care physician. And I think for some women that can really feel like they're being abandoned, and we don't want that feeling. I think, you know, getting in a community. So these support groups that we're starting are for women at any stage. So whether it's early diagnosis, in the middle of treatment, or long after as a survivor, you can connect back with a community of breast cancer patients. And these are online, as you said. You can participate either through video or audio only, as much or as little participation as you're comfortable with. And they're going to be led by a clinical psychologist. So her job is to facilitate the discussion. And we'd like to focus on, you know, coping with the diagnosis, body image, the anxiety and fear. How do you deal with the thought that this could come back? How do you talk to your family and friends? You know, sometimes that's the hardest thing, is telling other people that you have cancer, and then you're managing their emotions as well as your own. Those are going to be the third Wednesday of every month. They're going to run from 3:30 to 5 p.m. There are QR codes that are going to be posted at all of our locations so patients can join easily, and then we'll have that information up on our website. So even if you live in Greenville or Spartanburg, you know, that the location doesn't matter anymore. You know, thankfully we're all able to join via the internet.
That's great. I think that's going to be so important. One thing you mentioned, and I just want to follow up briefly, is the male breast cancer, because, you know, it's fairly rare. But I did have a friend who was diagnosed with it, and, you know, it was pretty difficult for him to deal with. He, you know, to get to somebody who knows how to treat men like women, and, you know, the clinical trials don't seem to be as robust in that area. Do you have any thoughts on that, Andrea?
Yeah, so male breast cancer is just as severe as female breast cancer, and sometimes even more so, because there is perhaps a stigma for men to present to, you know, a physician and say there's a lump in my breast tissue. Typically, we see that happening in later decades of life, so 60 to 70-year-old. Typically behind the nipple, there's you know, an accumulation of tissue. Some men want to play that off as like, oh, well, I'm getting softer, you know, I'm losing muscle tone. But, you know, any additional tissue, especially if it's one side as opposed to both sides, that's something that should be checked out. And there are a lot of options for treatment. Again, the earlier you seek care, the more options we have to offer. And the treatment isn't necessarily different per se between men and women. So it's just getting in and getting it checked out.
Yeah, he's become a very vocal proponent, and is now doing listservs with, you know, where clinical trials are for men and women, and he's, you know, it's really changed sort of his approach to life and everything. Of course, we always want to detect the cancer as early as possible. Are there certain populations or groups of individuals that are at much higher risk?
So I would say that if you have the opportunity, you know, the holidays are coming up, hopefully people are able to connect with their families, start having those conversations, you know, getting an understanding of what is the cancer history in your family. And once you know that, you can start to see if there are patterns. You know, if there's a lot of people in your family who have colon cancer, maybe you should start thinking about, should I be screened for colon cancer early? The same for breast cancer. So if, you know, mom or grandma had breast cancer, or ovarian cancer, that's another strong link. Breast and ovarian cancer are strongly linked together. We are very fortunate to have a very strong genetics team here at Hollings. So you can come in and just talk to them. There's no obligation. Just go through your family history, tell them what your concerns are, and they can walk through that with you and see, are you at potentially high risk? And then you can decide if doing the genetic testing is right for you. There is a lot on the internet and on the news about the home genetic tests. And I would just strongly urge people that if you were to do that and you got a positive result, to go see a true genetic counselor, like come in and have the full evaluation. Sometimes the genes that are tested in those home kits aren't the true genes that we look for.
Yeah, they could cause a lot of alarm needlessly. Now, one thing we hear is the dense breast, and if is that an increased risk, and what do you tell your patients about that?
Yeah, the concern for dense breast tissue is that maybe the mammogram can't pick up small early cancers. And so there is a law now that at the bottom of your mammogram report it should tell you if you have dense breast tissue. If you see that, then ask your physician if it wasn't offered to you, if there should be supplemental screening, and that can either be with an ultrasound or an MRI. And that will help detect, through
if
that.
there's anything there.
That's right.
Yeah. So there's lots of women wanting to participate in clinical trials. There's lots of different clinical trials going on all the time. Is there anything that you tell your patients to try to guide them on that topic and where to go and which ones to consider?
Once patients are here at Hollings, that's easier, right? Because we're reviewing their case in a multidisciplinary tumor board. So that means all of the clinicians sit together, as do our clinical trials team. So they have the whole portfolio in front of them. They're screening through the list, seeing if a woman is a potential candidate. So clinical trials can either be something that's in addition to the standard of care, something we offer extra to help, or it could be if you've gone through the standard of care and now you're looking for additional options. Maybe that's when the clinical trial comes in. Sometimes the clinical trial is there to help you as an individual, and there can be a direct impact for you. And sometimes we don't know that answer yet. And what you're doing is you're helping future generations, which could include your own family members. There's definitely research you can do online. We try to list our active clinical trials online. So if you're a patient who's not here at Hollings, you're somewhere else in the state, you could go online and see if there's an open trial for you. Yeah,
that's great advice. Andrea, is there anything else you'd like to share with the audience?
I think the most important thing that I could encourage people to do is talk to your family, understand your family history. I know those are difficult conversations, and maybe you just start that conversation and you have to come back to it a couple of times, but understanding your family history. Doing a self-breast exam, that is really important. Understanding your own breast tissue so that if there is a change, whether you're a man or a woman, knowing that so that you can bring that to the attention of your doctor. And I would also say if something doesn't seem right, don't stop until you get an answer.
Yeah, that's great advice. Thank you so much. Yeah. This is great information that we're going to share with others. I really appreciate your time today and actually all you do at Hollings to take care of these patients. It's really important. Next up, we have a special guest, LaToya Wilson, who wants to help share her message about the importance of screenings and participation in clinical trials. Thank you so much.
Thanks for the opportunity.
My little one, Daniel, which all of them are special, but that's my heartbeat, he asked me if I was going to die. I had to gather myself, and I broke it down to him, how the genetics and everything works in a way that he can understand. And I think that because I've explained it to him, then it's less
of a danger. Because there are options and
there are.
LaToya, we really appreciate you joining us to share your experience. When were you diagnosed and how has your cancer journey been? I know it's been a long one.
Yes, it's been a long one. And good morning, thank you for having me.
You're welcome.
So I was originally diagnosed in August of 2012, and I had a reoccurrence in February of 2015. And it's been a journey. The whole thing from the beginning I actually found a walnut-sized lump in my breast My son Daniel was about 11 months old, and I went to my primary care physician, and I was told I was young, it was probably a clogged duct, so, don't really worry about it. If it gets bigger, if it becomes bothersome, to come back. And so it never did bother me, but it did get bigger. And so I came to MUSC again, and I saw, I believe her name is Allison Neeson at Cannon.
Yeah.
And she was very, very proactive.
Right.
And she recommended that I come to, Hollings to have the mammogram done.
Right.
That turned into
Biopsies.
the biopsy, the whole shebang.
Yeah.
That day, I did the mammogram, the biopsy, and it's kind of like a waiting period.
Oh, it's very tense. It's very
After
tense.
that, for about a couple of days, and then I got the news, so kind of gathered myself, braced myself for what was to come. I knew I wanted to live. So, we did all the necessary tests, and then we dived into chemo.
And that started pretty quickly.
It started pretty quickly because, like I said, the tumor was already about walnut size.
Yeah.
So it had to have been there
For a while.
Yeah.
Well, from what I understand, you've been very supportive of clinical trials and trying to help others understand what those are all about. Can you tell me a little bit about your approach there and what you've been doing?
So initially, I was a little hesitant myself initially, but Dr. Brusha explained it to me, what was available. Not only he, but also the clinical trial team. They sat with me and explained, what it entailed. What I liked about it also is that you're monitored very, very closely. So it's a lot of appointments, but you don't slip through the cracks.
We don't want that to happen.
Right. And then another one of my concerns were, I was like, well, am I only going to be on the clinical trial? But it was explained that I would be on the trial plus a standard drug. So I think the goal was to see if the two in conjunction would work.
Right.
And so my family was not happy about it. They're like, why are you doing this? You're being a guinea pig.
Yeah.
And so, I did my own research too, and I discovered that all medications were initially a trial drug before it came to be.
Oh, yeah. Right.
So,
right.
And I was like, well, if I can do that, I'm not only helping myself, but if I can be a part of the big picture, even if it doesn't work in my favor, then I can be helping someone else.
Yeah.
So we did the trial. I think it was called tucatinib. And I think, if I'm not mistaken, is that like FDA approved now?
I think it is.
I think
actually.
it is. So
you probably helped with that.
yeah. So I did that. I did that for a while, and it worked for me. And then we moved on for something else. But I think that clinical trials are really important if you have that option, to be a part of one.
Yeah.
I say go for it.
I'm excited to hear you say that. Well, so the incidence of breast cancer in Black women is slightly lower than white women, but one of the issues that we're dealing with is that the outcomes are usually worse.
Right.
And there are lots of reasons for that, and it's one of the areas that Hollings is focused on with our community outreach, to try to get out there and detect those things earlier so we can improve the outcomes. And we really appreciate you, helping all you can to educate the whole community, but especially that segment, that have those worse outcomes. Right. How do you stay so positive, and how do you communicate your messages to be effective?
Well, number one, my faith. Not to be all religious, but that's my driving force. Children, of course, I want to be around for
we want you to be around too.
And I want to be around too. And that's my driving force. And just being an advocate and letting women know that just because you get the C diagnosis, it's not the end. And just letting our women know, well, not only our women, but everyone.
Right.
I like to be inclusive.
Yeah, the whole community needs to know, basically.
To, be proactive, know your body, get your mammograms.
Right.
One of the things also is I do encourage a lot of people, but they don't realize that they encourage me as well. So I do a lot on Facebook. Every now and then, I don't share everything, but I share what I feel is necessary, and I'm very transparent. I tell them the good, the bad, and the ugly, but I always end on a positive note.
Yeah.
There's always a silver lining.
Right.
It's not
And
the
there's
end.
hope.
There is hope. There is hope, and so that's basically kind of like my platform.
Great.
Is social media.
We were talking a little bit earlier about some of the interactions you've had with your family. You have 4 sons.
Yes.
And I know you try to keep everybody up to date on what's going on. So how do you deal with that? And are there any special moments you've had with your boys that you think have really helped them understand what's going on?
I think the second, when I had the recurrence, that was very, very scary for them, for me, but especially for them. And my little one, Daniel, which all of them are special, but that's my heartbeat, and that's my heartstring. But he asked me if I was going to die.
That's tough. That is tough. And
so, I had to gather myself, and like I was explaining to you all earlier, I broke it down to him, how the genetics and everything works in a way that he can understand. And I think that because I've explained it to him, then it's less
of a danger, because there are options and there are things to do.
So I don't tell them everything.
Yeah,
but
no, they're younger, and they don't know how to process.
But I'm very, very transparent, and if there's a new treatment that I have to start, or if I have scans coming up, I let them know. Hey, by the way, I have to do such
got a
and
good
such.
scan.
Yeah. So, just a little, not too much.
Right.
Just what's necessary.
Yeah, and not, you don't want them to feel like you're hiding something.
Exactly, right. Because it not only affects the patient, but it affects the entire family and everyone that you're connected to.
Right.
That makes sense.
Well, if there's one message you could give our listeners about this, what do you think it would be?
It would be definitely early detection saves lives. The earlier you catch it, you may have more options. Be proactive. Like she said earlier, do your breast exams. Clinical trials, if it's available,
Yay.
Do your research. I actually have a friend on Facebook, Mr. Green. I believe he lives in Atlanta, and he was given, I think, 6 months, and he had leukemia, and so he was a part of a clinical trial. 22 years later, he's still here.
Yeah, it can save your life, basically.
So, early detection, be proactive, clinical trials, and we're stronger together. That is my motto.
I like that message.
The online support group, I think it's awesome. I think it's fantastic to have that outlet, because sometimes we can't always go to our family.
Yeah.
But if you have a community of people that have gone through or are going through the same thing, then you lock arms together and you just support. So basically just keep pushing, keep fighting, and don't give up. It's not the end.
I love that attitude.
Yeah.
Well, thank you so much for joining us today. I want to thank our viewers as well for tuning into the Hollings Cross Talk. You could able to join us each month for a new segment, as always, and join in on the conversation by asking a question in the comment section when we broadcast these. For Hollings News anytime, visit the hollingscancercenter.musc.edu. Thank you so much.
Thank you for having me. Appreciate it.